of death cardiac dysrhythmia and noted obesity and chronic drug use.
If you'd taken him to the hospital, he would not have died.
Days after our story first aired, attorneys for the jailer and his deputies filed paperwork asking a judge to dismiss the case, claiming the lawsuit fails to identify specific actions taken by any particular staff member that contributed to Stratton's death. In it, they wrote the staff kept logs on his health, showing he was showered, showed signs of vomiting and diarrhea, received water, and skipped some meals. They say a deputy jailer also contacted the jail's medical provider, who recommended he remain under observation and be put in a safety chair as needed. 1 year later, attorneys suing for wrongful death on behalf of Stratton's family say he should have been sent to a hospital instead. They want to know what the jail and Southern Health Partners, the company hired to medically treat inmates, are doing differently.
You've got a young man who is naked in a cell. He's talking to people that aren't there. He is suffering. It's obvious. You do something, and nobody did anything.
According to the family's lawsuit, a nurse practitioner was at the facility seeing patients the day before Stratton died, but never saw him. The suit claims other jail nurses did not put him on a list to be seen by the nurse practitioner.
Southern Health Partners has policies and procedures that should have prevented what happened.
We've been asking questions since our first story last fall. We repeatedly, in person and over the phone, attempted to talk to former jailer Rick Rogers, who never responded to our requests, then retired in early September.
We've made a few changes since I've came in, nothing drastic.
Rogers' appointed successor, Jake Bonta, did sit down with us, but said he cannot speak about what happened to Dylan Stratton due to pending litigation. He did talk about treating everyone from staff to inmates equally.
My philosophy is people make bad decisions sometimes. That doesn't make them a bad person. I've always believed that. I believe in the justice system, but I also believe that these people in here are human beings, and we're going to be firm, fair, and consistent.
We've learned before Bonta took over, the jail in Franklin County Fiscal Court renewed its contract with Southern Health Partners, a Chattanooga-based company that serves approximately 30 jails here in Kentucky. The same company, Glass alleges in the suit, fabricated Stratton's observation records. She claims the day Stratton died, a nurse turned over only 2 columns of his chart. Then more than a month later, says Southern Health Partners submitted 2 pages of entries that she believes were fabricated.
He was unable to talk. He was in psychosis.
The lawsuit says there were no entries showing any deterioration in Dylan's condition, despite his obviously emergent psychotic condition and the progressive decline of his physical, mental, and emotional state as recognized by Judge Mangent less than 24 hours before he died. Here's a copy of his withdrawal chart 2 days before his death that showed no circled for signs of weakness, confusion, and slurred speech. Leslie Glass wants to know why her son didn't get more medical help even after the judge asked about it.
Are you all going to be able to transport Mr. Stratton?
Probably not, Your Honor.
Glass says Southern Health Partners didn't follow its own policies that state on the company's own withdrawal form it requires staff to report all findings to the medical director, especially if patient is not responding well. It goes on to state if patient experiences changes or deterioration is noted, to notify physician immediately.
They should be ashamed of themselves. I mean, what kind of medical establishment are you?
We once again reached out to Southern Health Partners to get an explanation. No one returned our calls. Last fall, an attorney referred us to the company's response to the lawsuit, which claims its staff acted in good faith and that if Dylan Stratton suffered any harm, it was a result of his own actions, not those of SHP. We asked new Franklin County jailer Jake Bonta about Southern Health Partners' new contract. He says the former jailer had already negotiated more medical care at the jail before he took over.
On a large